This is Doug Field along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. And we talk a lot about exchanges. We talk a lot about a lot of the moving parts. But one of the really hot and most discussed areas is transparency.
That's right.
What is it and what isn't? And we have with us today, we're pleased to have with us today, the CEO of Change Healthcare, one of the leaders in transparency, Doug Ghertner. Doug, welcome.
Well, thank you very much for having me.
Yeah, it's good to have another Doug on the program.
There you go.
Hey, Doug, you talk a lot about, Change Healthcare really talks a lot about exchanges and transparency. And, before we kind of take a deep dive into that, can you give our audience kind of a perspective on who is Change Healthcare and what's your unique position in this transparency space?
Absolutely. So Change Healthcare is a company. We contract with self-insured employers and health plans, and really the premise of what we're trying to do is help employees or members make more informed purchasing decisions when it comes to their health care. A big part of our focus and our differentiation is that it's not just about providing the right information to the individuals, but it's actually getting them to take advantage of it. I think one of the things that the healthcare industry as a whole really lacks is consumer engagement. And so for us, that's really what we're trying to solve is the engagement challenge. And we see cost transparency, we see member education as levers that we can use to solve that engagement issue.
I can see how you've evolved over the last few years to really position yourself as more of an engagement company around this transparency. I think you're dead on. Talk to me a little bit how you see the private and public exchanges and your piece and where you can help, both organizations and individuals.
Sure. So, as the market shifts, and we've seen sort of this massive retailization of healthcare over the last couple of years, and it certainly will accelerate, whether that's the 50 million people in Medicare going to 70 million by 2030, whether it's the 20-some-odd million people expected to be in the public exchanges, or what is now, I think there was an Accenture study that came out recently that suggested north of 40 million people by 2018 will be in the private exchanges. I think with that dynamic, all of a sudden you have folks who've either never purchased health care before, or if they have, they purchased it through their employer, and we're now asking them to make those purchasing decisions themselves. Mm-hmm. And I think with that comes a need for a fundamentally different set of tools and resources. And, for us, at Change Healthcare, a big part of that is education and making sure that if you are going to put that responsibility on the individual, there are an adequate set of tools and resources out there for them to make informed decisions. One of the things that we realized, and this was probably 12 months ago, is most folks don't understand the basic terminology of healthcare. They don't know what a copay is or how coinsurance works. And unfortunately, those are the same dimensions on which they're making very important financial decisions. I'm not sure if you all saw George Lowenstein, who's an academic at Carnegie Mellon, just published a report in the Journal of Health Economics a couple weeks ago. And it was studying the fact that I think he surveyed, I can't remember the number of individuals that he looked at, but basically he assessed their understanding of four key healthcare terms: copay, coinsurance, deductible, and out-of-pocket. Mm-hmm. And what he found was that only 14% of people adequately understood those very basic fundamental terms. And so for us, before you even get into the opportunity from a transparency perspective and influence folks' decisions on which providers to utilize or which types of products they should seek out, there's a basic understanding gap or knowledge gap that really needs to be addressed. So I'd say that's, at least for us, as we look at the exchange marketplace, public or private, I think you're going to need a set of educational and decision support tools to really help ensure that is a smooth transition for folks.
Yeah, I agree. When you look back at that study in the 14%, that's not really surprising, is it? I mean, benefits have been an entitlement program for those privileged to have them, and no one's had to think about it. You go to the drugstore and people think things cost $4. You go, even if you got a good plan, you go to the emergency room and think it only costs $50, not $5,000. So there hasn't been a reason for people to really understand the terms. So now we got to play catch up, right?
You're You're exactly right, and I think in addition to the retailization of healthcare, you've got this overarching trend towards consumerism that really is manifesting itself in the form of a different type of plan design. And so, I think last study I saw, 34% of people are in plans where the deductible is greater than $1,000. You've got another study came out, said that over 70% of plans offered a high deductible plan option this year, and I think it's supposed to be north of 80% next year. When you start to push that financial responsibility to the individual, all of a sudden I think there's a much greater need to care. Because to your point, before when you had a $250 deductible and everything was a flat $10 or $25 copay, that incentive to understand the mechanics and understand what things truly cost really wasn't there.
Yeah, we say, that we echo where you are. Obviously we're healthcare consumerism, and we were created because we identified this healthcare consumerism megatrend long before ACA was even being debated. And now it's really here and moving through what we call rapidly forward through the early majority adoption phase into full phase adoption. Everyone talks about private exchanges, but we see running parallel an explosion of full replacement, programs being put in place, married to an HSA or an HRA, and the need for tools, like yours and others wrapped around these plans to really help these consumers be better consumers of health and healthcare.
Absolutely. I'll tell you, one of the things we've been most excited about is an educational product called Healthcare University. And
tell us about that. I read about that. Tell me about that. That's very interesting.
Yeah, certainly. So product plays on the premise, again, that people don't understand the basic terminology of healthcare. And in essence, what we did is we took benefits information and the way in which benefits education was delivered and really reimagined that process using videos, quizzes, challenges, game mechanics, etc., to make it a much more engaging experience. And we've seen a tremendous amount of traction in the marketplace among our self-insured employers, whether they already have a full replacement CDHP in place or are looking at incorporating some new benefit designs to their offering. They view these educational types of tools as a way to kind of ease that transition and minimize disruption. We've also seen a ton of interest, though, on the health plan side of the house as they think about playing on the public exchanges or even making their offerings available on private exchanges. There's this overarching belief that they need to be much more consumer-oriented if they're going to acquire lives individual by individual. I'll give you one case study that really was eye-opening for us. So Blue Cross Blue Shield of Minnesota is a client of ours, and while they've rolled out Healthcare University to a whole host of their clients, they actually made it available to their own employees as well. So they've got about 3,500 employees. And in the first 6 weeks of launching this platform, we saw roughly 40%, so 1,400 of their employees access the tool. They watched over 9,000 videos. They took over 7,500 quizzes, and they played over 19,000 games on what I would argue is probably the most boring and mundane content out there, right? Benefits information.
Right. Yeah.
But what it told us is that there's absolutely a thirst at that consumer, at that individual level for this type of information. It's just a matter of people finding a much more interactive, user-friendly, and engaging way in which to deliver it.
Yeah. Doug, this is Brent. Going back to the exchanges, are you trying to talk with the exchanges themselves out in the marketplace and embed your solution with them? Is that a model for you?
Certainly one of the options. We see the opportunity really across three primary dimensions. First and foremost is helping that employer communicate to their employees the fact that, hey, we're going to make a shift and we're going to give you this set of funds for which you can go purchase your health care on a private exchange. So supporting that employer is one opportunity. The second is working with the health plans who are going to provide products on the exchange. So it becomes a way in which they can differentiate themselves among the other health plans that might be offering plans on that exchange. And then to your point, the third opportunity is working with, whether it's the Aon Hewitts or the Towers Watsons or the Mercers of the world, who have created these private exchange marketplaces, and how we can help them add a set of consumer tools to their suite of products and really improve that member experience, because we think that's a way in which they can differentiate themselves from other exchange providers.
That's a pretty interesting announcement this week. Your old employer moving to a private exchange. How Walgreens putting 165,000 people into a private exchange.
They did. They're not my old employer, and I say that only because my CVS colleagues would come after me. But what I would say, it was very interesting, and I think we've started to see that trend with some really progressive blue chip organizations, whether it was IBM, whether it was Time Warner. Certainly Darden and Sears were first out of the gates. But I think Walgreens doing it really does have a high degree of significance, because they are a sort of in that retail space, and I think that's very representative of the American population. And as you start to see big organizations like a Walgreens take this leap, I think you're going to see a whole host of organizations follow. Maybe not in 2014, but certainly as you move through to 2015.
Yeah. And actually, my apologies. I knew you were CVS. I've got Susan Hayes, who's a friend of ours and a leading pharmacy benefit consulting, on the next segment, and that's her background. So sorry about
that. Very good. No worries.
Doug, looking at the, staying with the exchanges and specifically the employer, is engagement is big. Is there a misstep that an employer could take in these exchanges that we need to raise the awareness on in terms of when they flip the switch for their employee population? Because much to your point, we really haven't been consumers of health and healthcare before, and this exchange, you're flipping a switch and sending people in. So what's from the employer's seat, what would you recommend that they really pay attention to if they're making this step?
Well, I think first and foremost it is just communication and making sure people understand how they can get the most out of this pool of healthcare dollars that are going to be allocated to them. I think the second thing I would tell you is, every study that I've seen, I recently just saw another report from Aon Hewitt that came out that said that employees, when those dollars are put into their control, will typically gravitate towards the plan designs that have the lowest premium. I think when people talk about the public exchanges, I think that's the same type of sentiment that a lot of these initial surveys are suggesting, is that folks are going to trade off access. They're going to trade off a richer benefit for a lower premium. And consequently, I think it is important that if that's going to be the expectation, as plan sponsors, as employers look at folks who are going to administer the plans that their employees will go into, that there are tools to help people navigate. If you think people are going to gravitate towards those high-deductible plan options, you really do need a transparency tool. You need something that allows people to make informed decisions, because now the financial burden is much more on them as individuals. One of the things we always say, and it's probably our biggest difference or differentiator from a transparency perspective, you can have the greatest cost transparency tool. It can have all the bells and whistles on it, but if nobody uses it, it's not going to drive any value.
Amen.
So, well, thank you very much, Doug, for joining us on the program today. For everybody out there, you can find more information on Change Healthcare at their website. Doug, have a great weekend, and to our audience, stay tuned for the next segment of Healthcare Consumerism Radio.